I'm Dr. Noya Odukwe. I'm one of the residents at Sinai. My specialty is internal medicine and pediatrics. And I also have an outpatient clinic at Settlement Health. We're here to talk about COVID-19, the short of it and the long version of COVID, but very briefly. Let's review. Short term for coronavirus, a virus that has respiratory, so lung, constitutional, so full body, as well as stomach symptoms. So if you all look to the far right in the red, those are the slew of COVID symptoms. So respiratory can be the sneezing, the runny nose, the sore throat, because that includes like your lung, your throat, all the way down to your lung, cough, shortness of breath. More full body constitutional symptoms are the fever, the chills, the headache, the body aches. And then more so the GI symptoms or like stomach symptoms is vomiting and diarrhea, some nausea as well. So as you can see, COVID takes literally almost all the types of symptoms. Common cold, less so. Flu also almost the same as COVID. But what is a notable distinguishing factor between the two is loss in taste of smell. And so how was COVID spread? Again, so somebody sneezes, and they don't have a mask, and then you're in their vicinity and you inhale the respiratory particles that's like traveling in the air kind of here. It mostly hits like your T zone area. And also, even if you're not around someone, if they sneeze into the environment and the particles like drop on a surface and you happen to touch the surface and touch your T area, that's likely to spread coronavirus as well. Depending on the surface and your proximity to the person, some of the COVID microbes can stay on surfaces for as long as like up to 7 days. So that's why like disinfectant, especially like alcohol-based disinfectant, that's why we were seeing so many folks cleaning all the time, all the time, all the time. And some folks don't show symptoms, as we know, like right when someone sneezes on you or even a day or two. Some folks don't show symptoms until 3, 4 days after exposure. So yes, sneeze, not wearing a mask, T area, and even if you sneeze and it goes onto a surface, depending on the surface, the microbes can stay there for as long as 7 days. And if you touch your face 3 to 4 days later, you might have some symptoms too. Those are mostly the symptoms of like short COVID or like short course of COVID. How we treat it, really no antibiotics, because antibiotics are for bacterial infections. COVID is a virus. And so it's a lot of symptomatic treatment, meaning you just treat the symptoms. So if you're dehydrated, chug some water. Some people also like Pedialyte. Some people like Gatorade. I heard of this other one recently called electrolyte. IV hydration is like a powder form that you pour into your bottle of water, but just keep yourself hydrated so that you're not just losing all that fluid. Tylenol or ibuprofen as needed for fever or body aches. Steam showers just to help if you're congested, and then Vicks Vapor Rub as well, just to help if you're congested. If the virus progresses, it might progress to a pneumonia, and the pneumonia is an infection of your lung tissue. Now, this is the thing about pneumonias. Pneumonias can be viral, which again is COVID. Pneumonia can also become bacterial, which is unfortunate. And in the case, if you do have bacterial pneumonia, and it's hard to tell just from an initial workup if it's bacterial, but some doctors will err on the side of caution. And if you do progress to a pneumonia, even if it started off as viral, it can also be bacterial. So in that instance, they will give you antibiotics. Some antiviral medications, though, especially to treat COVID, are Paxlovid. Some of you may have heard of this one. Remdesivir and molnupiravir is not really in the US, but some hospitals have it. But the major ones in the US are Paxlovid and Remdesivir. And what determines whether you get Paxlovid and Remdesivir are 1, your age, 2, how long you've had symptoms, and 3, of course, what's available at the institution that's treating you. And so again, Paxlovid, Remdesivir, and molnupiravir are specific antiviral medications to treat COVID. But, let's not even get COVID. Let's see how we can prevent it, because that's why we're here. We don't even want to get sick. So what should we be doing? Masking, 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 and for the millionth time, masking. Even though COVID numbers have significantly reduced, introduced. We're always in some type of respiratory season. Up to this day, I still wear masks in my clinic. If I'm in the train, I typically wear masks as well. This is not to push masks on individuals. I am just giving you recommendations on instances to wear them. And if you can notice, the instances I'm giving you are very crowded, closed places. And especially, you don't want to get when you know somebody else around you might be sick. So those are the instances that I wear masks. Not necessarily like if I'm in a restaurant, not necessarily if I'm walking down the street. Dealer's choice, buyer's preference, but especially in areas where you hear cough, cough, sniffle, sniffle, or an area where it's enclosed and you're going to be there for a couple minutes. Hand washing, always, always, always. And hand washing can be with soap and water or even with your handy dandy alcohol-based hand sanitizer. I still have a hand sanitizer in my bag, especially when I'm on trains or know that I'm going to be touching a lot of public surfaces, because remember, these microbes can stay on surfaces depending on the surface for up to 7 days. And then if I touch my face, eventually I might get it. And then, of course, last but definitely not least, vaccination. And I will talk about vaccination options towards the end. Hopefully, folks have gotten at least their initial COVID vaccination as well as the 1 or 2 boosters after that. And then depending on your health status, you may necessitate a 4th, 5th vaccine. The newest booster is still out. What are the COVID numbers like today, or at least over the past couple months? So this map is showing us how many new cases or how high transmission has been in New York City area since August 4th of this year up until the 27th of October this year. Love to see it. The graph is going down. Lovely, lovely, lovely. And this is in part because people are vaccinated, people are wearing masks, people have built up immunity, people are taking much better care of themselves, thank goodness, when the virus first came around 4-ish years ago. Obviously, we've made progress, but we want to get this even lower and lower, because what this graph is saying is that out of every 100,000 people in New York City, we still have about 12 people still getting infected. So we know in New York there are millions. So this is still definitely in the thousands that a new case is diagnosed, like in the 12,000s daily. This graph is showing us how many people are going to the hospital because of COVID. Again, love to see it going down. But what this graph is telling us is that in New York City, once a day for the past week, about 10 people are being hospitalized for COVID. Again, significantly improved compared to where we were before, but we really need to keep this number going down, down, down. And then last but not least, sadly, some people are still dying from COVID. This is still a reality. Thankfully, again, the graph is still moving down. So far, as of October 26th, once a day for the past week, one person has unfortunately died from COVID. So we're not out of the woods, but definitely compared to where we started, much of an improvement. Just wanted to give these numbers of like where we were as early as August and then where we are as of like last week. I mentioned earlier acute symptoms of COVID with the respiratory stuff, like the cough, the nasal congestion, the constitutional stuff, fever, body aches. Another respiratory was runny nose. And then the loss of smell and taste. Now, that's acute symptoms of COVID. Long COVID, which we know people suffer from, and you might even suffer yourself. And I'm sorry if you do, or you have a loved one that does. Some folks have like coughing and breathing problems. Some people have loss of smell, change of taste. Some people might still be having the body aches, headaches, still having stomach pain, having trouble sleeping, brain fog. I'll get to that in a moment. Some people have intermittent fevers, fatigue, and mood changes. Some of the symptoms of long COVID that people are unfortunately dealing with. Something I wanted to broach a bit more this time is the brain fog. So people use this phrase. When people started using it, I was like, what does brain fog really mean? So some people are unfortunately suffering from memory loss, difficulty concentrating, mental fatigue. Why is this even happening with COVID? Like, it's a virus. It's only supposed to be infecting my lungs. And like, maybe you do hear that, oh my gosh, yeah, some people have other organs affected because of COVID, their heart, their kidney. But really, this is like a virus that should be affecting my lung. Why is it affecting my brain? So the virus can enter, like when you breathe in through your nostrils, There's another set of nerves here called the olfactory nerves. Olfactory nerves are nerves that help you smell. The thing is, the olfactory nerves are a direct line into the brain. So it gives the virus a direct pathway to reach the central nervous system, including your brain. So that's how the virus can just get in. Once it's like in your neurons, in your blood vessels, the immune system is like, you should not be here. I'm going to try and zap you away, because that's what your immune system's supposed to do, protect your body from things that are foreign. The thing is, sometimes immune systems can go into overdrive. And when they do go into overdrive, this can trigger a lot of inflammation in the brain. And I'll get to inflammation later. But this inflammation can interfere with the brain's signaling system, and that can cause like some of this cognitive stuff that I was talking about, with the difficulty concentrating, the mental fatigue, as well as the memory loss. And then a little bit more about blood vessels. Because the COVID-19 has triggered like this inflammation response, the small blood vessels in your brain, if the inflammation and the degree of sickness is so bad, can cause damage, leading to poor blood flow in the brain, and that can also contribute to brain fog. So again, these are long-term symptoms of COVID, not the short, I got better in like 3 or 4 days. These are symptoms experienced by people who are experiencing or suffering through long-term COVID. And so inflammation, the virus gets in through the blood vessels and the lining. And so these are like the blood vessel side walls that I was talking about earlier. And when things are inflamed, or like your immune system is very active, you see like how close together and tight these vessels are. Because of inflammation and infection, a little doorway can open in between here and make the area a lot more leaky, because it's trying to also let the right immune cells come in and like travel to the other parts of the brain to help treat the infection. Now, the snag with that is clotting factors are also released into the bloodstream, and that makes it more likely for clots to form in a lot of these blood vessels. So you're changing the blood vessel wall. Instead of tight like how it is now, it becomes a little bit more leaky and open. And then, as I said, the signaling storm, the inflammatory response, can trigger more clot formation. And this is the thing. People think that clots are always bad, but clotting is how your body helps stop bleeding. Things get bad when things stay activated for such a long time. And that's the consequence of long COVID. All these things that should be normal and only for a short time are consistently on. And that's what leads to the negative side effects that we don't want. It's like too much of a good thing, basically. And so then on the right side, this is the immune dysregulation and the tissue damage. The virus is reactivating, and then you have persistent infection in your tissues. Again, your immune system is just always activated, leading to this like low grade inflammation. And this is what leads to like the clot of formation long term. And then this can also cause some scarring along like your tissue cells or even your blood vessels as well. And all these things, again, just lead to higher risk of clot. Again, long symptoms of COVID, not the short term, longer consequences of COVID. Things can happen to your heart. That's what I mean by cardiovascular impact here. What is the impact on some people's hearts? Because some people are like, oh, it wasn't just my lungs that were affected. I got something called like myocarditis or pericarditis. This terminology might be familiar to some of you. What that means is the infection caused a degree of inflammation in your heart cells, either the muscles of your heart cells or like the lining of your heart cells, that made either the squeeze function or the signaling function in the heart not good as it can be. Now, the thing is, myocarditis, pericarditis, which is like inflammation of like the heart muscle cells, that can typically be long term. And again, this only happens with very serious COVID. But on some cases, unfortunately, the squeeze function, the ability to pump blood to the other organs, that can be impaired in folks who have serious consequences of COVID. I don't like using the word heart failure because it's very scary, because people hear of liver failure and they think transplant. They hear kidney failure, they think of transplant. So heart failure, not everyone who has heart failure needs a transplant. So that's why I like to use the phrase instead, poor squeeze function, because it just means that your heart isn't squeezing as well as it can. But heart failure or squeeze function can be a consequence of very serious COVID. Again, oxygen is also affected, like delivery of oxygen, because remember how I said like the blood vessels aren't as tight knit as before. So oxygen isn't going to the rest of the body as well as it should. And your heart, like all your other organs, needs oxygen. It's very important. And so if your heart is starved of oxygen, unfortunately, this can lead to like a heart attack. So these are the cardiovascular, the heart and blood vessel consequences of long COVID or extremely serious case of COVID. So cerebrovascular impact, what that means is like blood vessels in your brain, because a lot of people unfortunately confuse the word stroke and heart attack. Stroke is when there's improper blood flow in your brain specifically, versus heart attack is improper blood flow in your heart. So in terms of stroke, because you're getting poor oxygen and also the inflamed state, the very thickened blood, all those as a consequence of COVID, because of all the activation of the immune system, there is a higher risk of stroke in long COVID or serious COVID activated patients. New year, new vaccine, new season, new vaccine. If you get it, you're not just protecting yourself, you're protecting others around you, especially folks who are pregnant, who are children, who are immunocompromised, meaning their health is not as good as the general population. This can be because of cancer, this can be because of kidney disease, this can be because of liver disease, this can be because of lung disease. Even folks with diabetes are actually considered immunocompromised to a certain extent. So the COVID vaccine doesn't guarantee 100% prevention. If you get the COVID vaccine, there is a much reduced risk of transmitting severe illness. This is preventing folks from going to the hospital. Remember that map that I showed you guys that is showing that things are declining? Again, vaccination, masking, and hand washing are all contributing to this. Vaccine out of the three being especially important. The babies can get the vaccines too as early as 6 months. The number of vaccines you need depends on your age, the vaccine type, and health status. I'm hoping that people have at least gotten like their 2 shots plus or minus the third. And then if you are in that immunocompromised category, it's like the seasonal flu vaccine for you, that you should get updated vaccines as soon as the updated vaccine is out. And the reason why we get updated vaccine is because COVID is super smart, just like you and me. They get smart and then they change tactics for how they're going to make our bodies sicker. So this is why people much smarter than me come up with the vaccines and see these new strains or new types of COVID and create a new vaccine to better protect us and better prepare us. Please ask your physician about COVID symptoms, testing, and the vaccines. Please ask your nurse practitioner, your physician assistant, your pharmacist, especially with the vaccines as well. Please stay up to date. The 2024 booster is available for folks 6 months or older. If unvaccinated, you'll need 2 doses of Moderna, 3 doses of Pfizer. Flu 2024 season is very active, so please get your flu shot as well if you haven't done so. For RSV, it's only available for our above 60s. Those are available in the pharmacy, but your primary care provider can send a prescription over to that pharmacy to get you the shot. And then last but not least, the pneumonia vaccine. If you are in a high-risk age, so someone who has asthma, someone who has COPD, or a lung tissue disease inherently, we need you to get your pneumonia vaccines. And then every adult older than 65, you need another like booster shot or even your first time shot of the pneumonia vaccine. And then you're seeing the high risk individuals here as well, greater than 65, pregnant. And then these are folks who are immunocompromised. This is just bringing us home to like long COVID. So cough, breathing, loss of smell, the body aches. Yes, these happen in acute COVID, but if you're still having these symptoms for months to years on end, you're in the long COVID category. Brain fog is typically long COVID. Trouble sleeping, fever, fatigue, mood changes, these are typically in long COVID. Unfortunately, there's no formal test for long COVID. What we have testing now is just short-term COVID. If you do think you have long COVID, please talk to your healthcare provider or scan this chart code to give you ideas or support in the community. And again, for those of you who suffer from long COVID or know someone who does, my sincerest apologies, because I have patients who do, and I understand it's very tough and life-changing. This is my wonderful clinic at 106 between 2nd and 3rd Avenue. This is our phone number. Here's my card here if you ever want to see me and make an appointment. My wonderful colleagues at work, we're happy to see you. I'm Dr. Noya Duque, happy to take you as a new patient.
Thank you so much for also validating people that are having long COVID symptoms. Sometimes that is not taken as seriously as it should. It's not referred to as a serious condition or illness. So I really appreciate you really underscoring that for us and making it clear to people that that is a real thing that treatment is available for, even as we're still figuring this out.
We are still figuring this out. This is the newest kid on the block in terms of like infections, and medicine does a lot of great things, and we have a lot of tools in our toolkit. However, a lot of the things that we're benefiting from now take time. And we really appreciate the population's patience. And we're really fortunate that we do have all these advancements that has led to less hospitalizations, less cases, less death. But we all really need to do our part in terms of prevention. None of us really want to get this anymore. And none of us want something else like this to happen again. Let's all do our part. Let's all get vaccinated, wash our hands, and hopefully we don't see something like this in our lifetime again.